There's a new report that just came out on the number of Hoosiers who died from Alzheimer's disease in 2020. That number is up, and part of the reason is the pandemic. But it's interesting what could go into those numbers too. Joining me live with more on the report and the pandemic's impact is Stephanie Lasky, Program Director for the Alzheimer's Association Greater Indiana Chapter. So good to see you, Stephanie. I want to dive right in and talk about these numbers being up. And obviously we know that. We've been covering this story. We know that COVID affects those over the age of 70 and 80 more. But there's something else interesting perhaps going on here. Let's first talk about the numbers and how much are they up?
Yeah, that's a great question. So we just released our 2021 Alzheimer's Association Facts and Figures report, and it shows that right here in Indiana, deaths attributed to Alzheimer's disease specifically were 14% higher than our than our previous numbers, for 2020.
And we know that, again, because of COVID, those numbers are up. When you're looking at those numbers, are they also up because of other things that have to do with COVID? And can you differentiate between those that actually have the virus and those that die from Alzheimer's?
Yeah, so that's a really interesting point when we think about death certificates, right? There's dying with a disease and dying from a cause. So some of these deaths may have been COVID. The individual may have died with Alzheimer's disease, but from COVID, particularly early in the pandemic when there wasn't a lot of testing, and we just didn't have another way to list the cause of death on the death certificate. So others could have been caused by challenges due to the pandemic. So somebody with Alzheimer's or dementia may have had reduced access to healthcare during this time. People were really scared to go into hospitals or long-term care communities. Disruptions in routine and, of course, social isolation could have accelerated the decline of people living with dementia. So all of these things related to the pandemic, even though the individual passed away from Alzheimer's or another dementia.
I want to dive into that social isolation piece. Daniel's grandfather died of Alzheimer's. You have a grandfather, I believe. My grandfather now in hospice care. And we do believe that the social isolation, almost a failure to thrive, is happening to a lot of these older individuals. And it is heartbreaking. How big of a factor do you think that could be?
I think that could be a really big factor, and for the people with Alzheimer's as well as any family and friend caregivers, right? So one thing that we're hearing is that it's really hard for caregivers to attend things like the support groups that my team puts on because they're just inundated with the day-to-day challenges of caring for their loved one with dementia. Maybe they don't have their normal routine of adult daycare or respite care or something like that. But I think that there's a huge possibility that this social isolation, we know when we teach a Healthy Living for Brain and Body course that social engagement and cognitive stimulation are two amazing things that you can do to protect your brain. And the pandemic has really taken those away from us in a really big way.
Stephanie, we're out of time. I would love to have been able to talk more, and maybe next time to really talk about if this is where we are, how do we help? What kind of hope do we give families, and how do we help those that are in a long-term care facility, for example, that we can't talk to? Come back again and see us so we can get that out there too. For now,
Gladly.
Yes, we'll go to fox59.com/links, hook you up with them. So if you need to talk to someone, you can.